check, 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 check. Check. What's up, everybody? I hope you're doing well. I am coming at you from my house this week. I got a almost fully recovered sick kiddo watching a show with snacks downstairs. So thus the reason for coming at you from home. Today we're going to talk about how to build trust with clients in that initial therapy session, maybe even a little bit into that initial phone call. I had scripted out this whole, what I thought was a lovely episode with little skits, but alas, I am at home and I am making it work. So I'm gonna just relay the information that I had scripted into skit format, and thank you for flexing with me. Now, of course, we all know how incredibly important it is to build trust with potential clients and with our clients. That's kind of the central tenet of what we're doing. If they don't trust us, then we're probably not gonna get anywhere. I feel like we don't spend enough time talking about how to build trust. We talk a lot about interventions, and we should definitely know those too, but you can know all the interventions, and if you don't have trust with your clients, then they're not gonna be successful. So I wish we talked more about building trust with clients, and what better time to build trust with clients than right at the beginning, right when they're first contacting you and right during that initial therapy session. And for today's episode, I didn't want to just repeat the same kind of trust building tools we often hear about, which very much are still applicable. I'm thinking about, fostering a non-judgmental environment, active listening, empathy, validation, setting treatment goals. Obviously those things still apply, but those are probably the things that you've most likely heard about already. So for today's episode, I'm gonna touch on little things and a little bit more clinical things as well that I don't often hear other spaces, therapists, training contexts talk about when it comes to building trust. Usually people reach out to me via email to schedule that initial consult call. And when we get on that initial consult call, I like to make sure that I at least acknowledge something about what they said in their initial email. And so if I just say oh, hey, you mentioned in that email you've been really struggling since 2022, tell me more about what's been bothering you. The smallest detail. This might sound obvious and or silly. I'm not trying to say go ahead and psychoanalyze their email or anything. It's just oh, I read that they said that they've been struggling since 2022 and now I'm asking them about that. Anything that they acknowledged in that early initial interaction, just acknowledging it again when you first speak with them in that initial consult call, I think is one of those little breadcrumbs that helps build trust. And along the same lines, I do have my clients fill out a pretty extensive history form as part of their initial paperwork before we meet for a first session. I notice a lot of times folks will start to tell a story that they already wrote about in their intake paperwork as though maybe this might be my first time hearing it. They're not necessarily sure that I actually read all of it. So if I hear them starting to flag something that I already read in their history form, then I will just make a very gentle acknowledgement oh, right, I saw that you wrote about that in your form and I was curious to ask you more. You don't have to memorize the whole form, just, yeah, I saw that you wrote about that and that sounds really important. Let's make sure we have some time to talk about that today. A lot of clients will be oh, you can see that relief on their face, oh, you read my forms. And then sometimes they'll even just sort of jump right into it, okay, you read that. So picking up where we left off then from the forms, almost diving further in, diving deeper, which is exactly what we would hope for when somebody is building trust with us. Another way that I lean into building trust early on is by deflating any shame or embarrassment that a client might have in that first session. It could be about anything. It could be that they're running late because they got lost on their way to your office for their first time and they're feeling sort of flustered about it, and maybe I might say something that traffic coming down that freeway is always a beast at this time, I get it. Or it may be shame or embarrassment directly related to their presenting issue. They might say oh my gosh, I'm really embarrassed to talk about this. I haven't told anyone before what I'm trying to work up the courage to tell you. Then I might try to deflate some of that shame by saying something it's probably not anything I haven't heard before at this point, but regardless of that, it's most important that we wait until you feel ready to share. Basically all of these are amounting to saying whatever it is, it's okay. And we're still here. It's gonna be fine. And the next tool that I like to use, I kind of touched on a little bit in the last example, but when appropriate and when it seems like this particular client would be receptive to it, to deflate any kind of nervousness or anxious energy with some humor. Like, I've had first sessions with clients where we're meeting virtually and they're sitting in their bathroom on the toilet with the lid closed, not actually using the toilet. They're just using it as a confidential space, to be clear. And, they're clearly often a little bit embarrassed by it. And they'll say like, oh, this is, my most confidential space. And I'll throw in some sort of humor about it and say like, hey, we just do whatever we can to make it work. I'm just glad that you're here. Some clients really respond well to humor and it helps them kind of soothe and have some relief. And other clients it might just be totally off-putting. Another tool that I like to use to build trust and kind of deflate anxious energy as well, if things are feeling maybe too intense for this client, like we're talking about intense things and we don't even have kind of a dynamic yet. We haven't built a system, a sense of trust of like, here's what we do here, and we're just diving into a topic that's really intense for our client, then I will try to find an equalizing point of connection at a much shallower level. For example, let's say we're meeting virtually and there's a cat in the background, which I don't have my cat in the background right now, but sometimes it'd be true here. Then I might, kind of pause if somebody is clearly uncomfortable and sort of say, do I see a kitty friend in the background? Who's that? What's their name? The goal is connecting. Say, I see you have a cat. Tell me about your cat. That's part of your life, even if it's not the most important part of your life or the reason why you're coming to see me. It's me asking an engaging question about something that is part of your life. Finding things like on their person or in their virtual background that you can kind of ask about in a way that is connective or engaging as a way to kind of build some trust before you get into deeper things. Another thing that I like to do to try to build trust with clients is prefacing any assessment process questions with some information about how this ties back to the client's presenting issue or, how it ties back to our treatment planning, so that it doesn't just feel like, who is this lady asking these really intrusive questions and I'm here for help with panic attacks today and now you're asking me about my mom when I was 5. Like, what does this have to do with anything? I think it can be helpful to everyone to have just a gentle preface of like, I know that you're here for panic attacks, and I also like to ask everyone just kind of more zoomed out questions about their life story, because that helps give me a lot more context for why you're coming in, who you are, and how to then best support you with the reason why you're here. So I'm gonna ask you a little bit about your childhood. Is that all right? And of course, before ending the first session, I think it's always so important to circle back to treatment planning. This is something that I was definitely taught, and I imagine all of us are taught, but it's also not unusual that, we get towards the end of the time in our first session, and I'm still like halfway through my assessment questions. There could be any number of things that cause the treatment plan to not necessarily be ready by the end of the first session. But I think it's always so important to circle back to treatment planning and acknowledging it by the end of the first session, because what we don't want is to sign off of the first session and we're gonna meet for session number 2 and we're gonna wrap up our treatment planning. I just need a little bit more time. But if you don't communicate that to your client, they might just feel like they showed up, you asked them a bunch of intrusive questions, and then you signed off and scheduled another appointment. So is that therapy? Is that what therapy is? You just keep asking a bunch of questions? Any kind of acknowledgement of like, yes, I haven't forgotten, we are making a treatment plan. Here's where I'm at with that so far, is so important. Okay, well, those are not all of the things that we do to build trust. These are not all the things that I do to build trust, but those are some of the things that came to mind for me when I was asking this question of like, what do I personally do as Marie to build trust with clients in those very initial interactions? And I imagine from therapist to therapist, there's gonna be kind of different tips and tricks that are especially tailored to your particular environment, workplace, presenting issues, populations, things like that. Keep all that in mind. But I'd love to kind of keep this conversation going, get the ball rolling. Like maybe you talk about it in your consult group or supervision or wherever you're interacting with folks in your context of like, yeah, what are the things that we do to build trust with our clients early on? And I bet you each have tips that other people in your circles haven't thought of that you can kind of like, swap tips with each other basically. Well, thanks for joining me in my house with my child at hand and without my usual skits and sort of A game. Hope you didn't mind too much. And before we close, I'd like to thank TherapyNotes.com for sponsoring today's video. TherapyNotes helps with all of your practice management needs, from scheduling to notes to billing. They have a HIPAA-secure telehealth platform available for all users and a whole suite of AI features to help streamline your note-taking process. If you'd like to check out TherapyNotes, you can get 2 months to try it for free with no commitment just by clicking the link in the description of this video. Well, thanks again for joining me. I hope you didn't hear Spidey and his amazing friends too loudly in the background, but I guess I'll find out when I edit this later. It's fine. It's fine. Whatever's going on in your world, until next time, from one therapist to another, I wish you well. What I definitely see. Oh, yes? Hi. I'm filming a video for my work.
Why?
And my camera up here. Well, don't push the buttons. No, I need those. Don't push my buttons. This is my whole life.
I'm under bed.
Oh, kiddo. How do I fix this? Okay. Do you need something?
I need some more hot cocoa, and I want you, and that's all.
You need some more hot cocoa? Understood. Okay. To be continued. Don't push any buttons.
I know.
Don't push buttons. Don't push.